What is the relationship between the foramen magnum and spinal cord? Superior, inferior, posterior, or anterior? Superior. The foramen magnum is the large opening in the occipital bone. The spinal cord is continuous with the medulla oblongata and exits the skull inferiorly through this foramen. How is the obturator internus positioned relative to the obturator foramen? Deep, inferior, medial, or lateral? Deep. The obturator internus originates on the deep internal surface of the obturator membrane and foramen, lying within the pelvic cavity along the lateral pelvic wall. What is the position of the xiphoid process relative to the sternal body? Superior, inferior, anterior, or posterior? Inferior. The xiphoid process is the small, cartilaginous inferior tip of the sternum that extends downward from the body of the sternum at approximately the T10 vertebral level. How are the plantar ligaments positioned relative to the plantar muscles? Deep, lateral, medial, or superficial? Deep. Plantar ligaments are deep stabilizers of the foot arches, located deep to the layers of plantar muscles. What is the relationship between the mitral valve and aortic valve? Lateral, posterior, anterior, or medial? Posterior. The mitral valve is located posterior and slightly left of the aortic valve in the left heart, with fibrous continuity between their annuli. How is the tibial nerve positioned relative to the popliteal artery? Posterior, anterior, medial, or lateral? Posterior. In the popliteal fossa, the tibial nerve lies most posterior, with the popliteal vein anterior to it and the popliteal artery most anterior. What is the position of the gallbladder relative to the portal vein? Inferior, medial, superior, or lateral? Lateral. The gallbladder lies in the gallbladder fossa on the inferior surface of the liver, lateral to the portal triad structures at the porta hepatis. How are the cerebral hemispheres positioned relative to the phallic cerebri? Inferior, superior, medial, or lateral? Lateral. The phallic cerebri is a dural fold that projects into the longitudinal fissure. Each cerebral hemisphere lies lateral to this midline partition. What is the position of the quadriceps tendon relative to the patella? Distal, proximal, posterior, or anterior? Proximal. The quadriceps tendon is the combined tendon of the four quadriceps muscles that inserts onto the superior pole of the patella, making it proximal along the limb axis. How is the median nerve positioned relative to the brachial artery? Medial, deep, lateral, or superficial? Medial. In the arm, the median nerve typically runs medial to the brachial artery, a consistent relationship important for avoiding iatrogenic injury during procedures. What is the relationship between the jejunum and duodenum? Distal, proximal, anterior, or posterior? Distal. The jejunum begins at the duodenojejunal flexure, making it the distal continuation of the duodenum in the small intestine. How are the hamstring muscles positioned relative to the adductor magnus? Medial, anterior, lateral, or posterior? Posterior. The hamstrings are located in the posterior thigh compartment, posterior to the adductor magnus muscle. How is the common hepatic artery positioned relative to the portal vein? Anterior, medial, posterior, or lateral? Anterior. In the hepatoduodenal ligament, the common hepatic artery is typically anterior and to the left of the portal vein within the portal triad. What is the relationship between the optic tract and optic chiasm? Anterior, posterior, medial, or lateral? Posterior. The optic tracts are the posterior continuations of the optic pathways beyond the chiasm, carrying visual information from both eyes to the thalamus. How are the intervertebral discs positioned relative to the vertebral bodies? Superior, anterior, between, or inferior? Between. Intervertebral discs are fibrocartilaginous joints that sit between adjacent vertebral bodies, acting as shock absorbers and allowing spinal movement. What is the position of the brachioradialis relative to the extensor carpi radialis longus? Lateral, deep, superficial, or medial? Medial. The brachioradialis forms the lateral boundary of the cubital fossa and is medial to the extensor carpi radialis longus in the forearm. How is the splenic artery positioned relative to the splenic vein? Anterior, inferior, posterior, or superior? Superior. The tortuous splenic artery typically courses superior and anterior to the straighter splenic vein along the superior border of the pancreas. What is the relationship between the caudate lobe and right lobe of liver? Posterior, lateral, medial, or anterior? Medial. The caudate lobe is a medial subdivision of the liver, located posterior to the porta hepatis and anterior to the inferior vena cava. How are the plantar fascia positioned relative to the plantar muscles? Medial, superficial, deep, or lateral? Superficial. The plantar aponeurosis is a thick, superficial connective tissue sheath on the sole. All plantar muscles lie deep to it. What is the position of the anterior tibial artery relative to the tibia? Medial, lateral, posterior, or anterior? Anterior. The anterior tibial artery runs on the anterior surface of the interosseous membrane, closely associated with the lateral aspect of the tibia in the anterior leg compartment. How is the recurrent laryngeal nerve positioned relative to the thyroid gland? Anterior, medial, posterior, or lateral? Posterior. The recurrent laryngeal nerves ascend in the tracheoesophageal groove, passing posterior to the thyroid gland, making them vulnerable during thyroidectomy. What is the relationship between the quadrate lobe and gallbladder? Superior, inferior, medial, or lateral? Medial. The quadrate lobe is a medial subdivision of the liver, bounded laterally by the gallbladder fossa and medially by the ligamentum teres. How are the lumbrical muscles positioned relative to the flexor tendons? Proximal, dorsal, distal, or palmar? Palmar. The lumbricals are small intrinsic hand muscles that originate from the palmar surfaces of the flexor digitorum profundus tendons. How is the superior cerebellar artery positioned relative to the oculomotor nerve? Posterior, anterior, superior, or inferior? Superior. The superior cerebellar artery passes superior to the oculomotor nerve as the nerve exits the midbrain. What is the relationship between the lingula and left lung? Lateral, inferior, medial, or superior? Medial. The lingula is a tongue-like projection of the left upper lobe that is located medial and inferior, representing the homologue of the right middle lobe. How are the dorsal scapular nerve and artery positioned relative to the rhomboids? Deep, medial, superficial, or lateral? Deep. The dorsal scapular nerve and artery run deep to the rhomboid muscles which they supply. What is the position of the cystic duct relative to the common hepatic duct? Inferior, lateral, medial, or superior? Lateral. The cystic duct, which drains the gallbladder, joins the common hepatic duct from the lateral side to form the common bile duct. How is the musculocutaneous nerve positioned relative to the coracobrachialis? Posterior, lateral, medial, or anterior? Medial. The musculocutaneous nerve typically pierces the coracobrachialis muscle, entering it on its medial side in the proximal arm. What is the relationship between the falciform ligament and liver? Inferior, anterior, posterior, or superior? Anterior. The falciform ligament is a peritoneal fold that attaches the liver to the anterior abdominal wall and contains the ligamentum teres. How are the deep perineal nerve and anterior tibial artery positioned? Superficial, lateral, medial, or deep? Lateral. In the anterior leg compartment, the deep perineal nerve runs lateral to the anterior tibial artery along the interosseous membrane. What is the position of the genioglossus muscle relative to the geniohyoid muscle? Deep, superficial, inferior, or superior? Superior. The genioglossus lies superior to the geniohyoid at their origin on the mental spine of the mandible. How is the superior mesenteric vein positioned relative to the superior mesenteric artery? Anterior, posterior, right, or left? Right. Within the root of the mesentery, the superior mesenteric vein lies to the right of the superior mesenteric artery. What is the relationship between the piriformis muscle and sciatic nerve? Inferior, superior, anterior, or posterior? Superior. The piriformis exits the pelvis via the greater sciatic foramen. In most individuals, the sciatic nerve exits inferior to it. How are the palmar aponeurosis and flexor tendons positioned? Superficial, lateral, deep, or medial? Superficial. The palmar aponeurosis is a thick, triangular fascia that is superficial to the flexor tendons in the palm, continuous with the palmaris longus tendon. What is the position of the middle meningeal artery relative to the dura mater? Superficial, lateral, deep, or medial? Deep. The middle meningeal artery runs within the dura mater on the inner surface of the skull. What is the relationship between the round ligament and uterus? Anterior, posterior, superior, or inferior? Anterior. The round ligament of the uterus runs anterolaterally from the uterine fundus, through the inguinal canal, to the labia majora. How are the superior and inferior gluteal nerves positioned relative to the piriformis? Inferior, posterior, superior, or anterior? Superior. The superior gluteal nerve exits the pelvis superior to the piriformis muscle. The inferior gluteal nerve exits inferior to it. What is the position of the vertebral artery relative to the cervical vertebrae? Anterior, medial, lateral, or posterior? Anterior. The vertebral artery ascends through the transverse foramina of cervical vertebrae C6 to C1. Anterior describes its initial segment before entering these foramina. How is the long thoracic nerve positioned relative to the serratus anterior? Superficial, medial, lateral, or deep? Medial. The long thoracic nerve descends on the lateral chest wall, running superficially on the surface of the serratus anterior muscle which it innervates. What is the relationship between the hepatic veins and inferior vena cava? Lateral, medial, anterior, or posterior? Anterior. The hepatic veins drain venous blood from the liver and empty directly into the anterior aspect of the inferior vena cava. How are the medial and lateral plantar nerves positioned relative to each other? Superficial, lateral, deep, or medial? Medial. The medial plantar nerve is larger and more medial. The lateral plantar nerve is smaller and more lateral. What is the position of the styloid process relative to the mastoid process? Posterior, superior, anterior, or inferior? Anterior. The slender styloid process projects antero-inferiorly from the temporal bone, anterior to the rounded mastoid process. How is the superior laryngeal nerve positioned relative to the thyroid cartilage? Superior, inferior, lateral, or medial? Superior. The superior laryngeal nerve divides into internal and external branches superior to the thyroid cartilage. What is the relationship between the popliteus muscle and knee joint? Lateral, posterior, medial, or anterior? Posterior. The popliteus muscle forms part of the floor of the popliteal fossa and lies posterior to the knee joint capsule. How are the anterior and posterior tibial arteries positioned relative to the interosseous membrane? Posterior, anterior, medial, or lateral? Anterior. The anterior tibial artery passes anteriorly through the proximal interosseous membrane. The posterior tibial artery remains posterior to it. What is the position of the duodenum relative to the pancreas? Inferior, anterior, superior, or posterior? Inferior. The duodenum forms a C-loop that curves around the head of the pancreas, primarily lying anterior and inferior to it.